GP of almost 30 years, I clearly have an interest in the benefits of physical activity on the mental health and well-being of patients. One of the privileges of being a GP is providing continuity of care to patients of all ages throughout their lifespan, watching children grow into adults, become parents, become grandparents. We're always assessing problems in the context of family and environment. So as GPs, we're really well placed to directly witness how lifestyle, diet, exercise, socioeconomic factors, how they impact on the health and development of children. And equally, when we're dealing with adults with poorer physical and mental health outcomes, these can often be traced back to health and well-being issues they experienced in childhood. Like many GPs, I'm all too aware and somewhat concerned about the increasing number of children and young people who are presenting in our surgeries with emotional struggles, mental health difficulties, and behavioural problems. And although the reasons for this are clearly quite complex, I think it's really forced us to prioritise the emotional well-being of children and young people as much as we do their physical health, because we recognise the two are inextricably linked. But we're also so aware of the potential impact of poor mental health on longer-term health outcomes. So as an investment for the future, I feel that happy, healthy children generally become happy, healthy adults. As GPs, we're used to talking to our adult patients about the benefits of exercise and physical activity on their mental health and well-being. And we often will recommend exercise as part of a management plan for mild to moderate depression and anxiety, to be used in conjunction with psychological therapies and in some cases medication. But there's increasing evidence that children and young people will also respond in a beneficial way to increased levels of physical activity, especially aerobic exercise. That's exercise that gets you out of breath. And like adults, we see the benefits of increased release of those feel-good endorphins in the brain. We see the benefits of increased levels of brain chemicals that lift mood and reduce anxiety. We see children and young people who exercise improve social interaction and social connectivity, and also that opportunity for exercise to really focus your brain away from stress and worry, but on the task involved. There appears to be no doubt that if we get our children and young people moving and increasing their levels of physical activity, this will really help them manage the impact of anxiety and depression in their lives, help manage their behaviour and manage their response to stress. But in addition, there appears to be emerging evidence that increasing physical activity in childhood and early teenage years is associated with lower depression scores in later adolescence and adulthood. And the even better news is that the amount and type of physical activity that appears to give this protective effect doesn't necessarily have to be very vigorous physical activity or particularly prolonged, and that benefits are seen even with shorter periods of light physical activity. So the challenge remains, as always, to motivate children and young people to become more active or to stay active, especially those children and young people who aren't particularly attracted to traditional sports or exercise programs. And that's why fun and innovative activities to get children moving, such as Stormbreak provide, are so welcome and so exciting. I think anything that provides opportunity to motivate children from an early age to move their bodies and to discover the benefits, the immediate benefits of this on their well-being is to be welcomed, as well as being a really great investment for their future health.